Hi everyone, Dr. Elisa Kaufman from Manhattan, here with Dr. Anshu Bansal from Dallas, Fort Worth. And we are going to talk about communication and how we actually go through the steps for each dental appointment. So why don't you lead us through the steps from the time the patient calls the 866 number until the time you see the patient?
So it's very simple. It's like making any other appointment. When you call the 866 number, they reach out to me and then I call you back. Usually I ask you to be a little patient because I would like all the history, medical, for my patient to give my best service. So there would be a couple of forms, and I sometimes, if need be, I need to connect with the PCP, which I highly encourage all my families to help me with. And then I can give you a better idea of what the problem, what is the chief complaint that you are seeking me out. And we can discuss the fees, timeline, and when can I come and treat your family.
Right. Most importantly, if the patient is on any kind of blood thinners, that's going to be on the questionnaire. We want to know that. Only really, not if we're doing a filling, but if we're doing an extraction or something that will involve any kind of blood. Right. So we will want to know that. And if you don't know, we will call the primary care physician. Right. The most important thing is to take care of the dental complaint at the first visit. So we're not going to take a million x-rays and clean the teeth if the person has a toothache. Right. We will take the one x-ray, take care of that tooth, and then should you decide to have us come back, we will take care of the rest. It's always what's the most important reason for getting there. Anything else? I mean, are the families welcome to be at the visit virtually?
Absolutely, however we want. If you want to be there, great. If you can't be there, you can be on a FaceTime call, on a video call, or just on a telephone. Or if you would like me to follow up with you on the telephone, I can do that too. Whatever makes it easier and comfortable for everybody. So the whole idea is we should be on the same page regarding the medical condition and the dental condition. So it's a both-way help. So I need your help in filling out my paperwork to the dot, and you can count on me taking care of my patient in a good way.
So no ambulette, no two aides, no waiting in the waiting room, no worrying if the patient's going to behave because they're in unfamiliar surroundings. This is really the ultimate treatment. You don't have to go out to a van. We're not going to come with a big team so that they're not overwhelmed.
Yeah, and sometimes I always, when patients are like too picky, I'll tell them, oh, I'm your daughter's friend.
Yes.
I came by to see you. Or, I'm just the old niece. You haven't seen me for a while. Something that would make them warm up to you and not see you as a provider who's about to do something that they don't want it. So anything, anyhow to help and get that access is the goal.
Right. I do a little fibbing myself. Sometimes I say, if they have dementia especially, that I work for the dentist that you used to see, and he's so upset that you can't come in that he actually wants me to come to the house to treat them. And you cannot believe, I'm even going to do that today on our travels. You'll see. I hate to fib, but listen, whatever it takes to get the job done and to make them comfortable and feel comfortable with us. So if this sounds like something you're interested in, give us a call on our 866 number, 866-686-4423, and then Dr. Bansal will call you back.
Absolutely.
Look forward to meeting you guys.